Please take your seats. The program is about to begin.
And here's the twist.
Put your hands together for Axios political reporter, Brittany Gibson.
Good morning, everyone. Thank you for coming to Axios Live's Healthcare's Emerging Battlegrounds. Healthcare access and affordability are emerging and defining topics in this midterm year elections, as voters are weighing rising costs, coverage gaps, and debates over federal funding priorities here in Washington. To help us understand what Americans are really thinking about this issue, I'm joined by an expert in public opinion and health policy research. Please welcome Ashley Kirzinger, Director of Survey Methodology at KFF. Hey, good morning. Good morning. Thanks for being here, Ashley.
Oh, I'm so happy to be here. Good to see you all. Wonderful morning.
Okay, so it won't be a surprise to this audience that healthcare is a major issue this midterms. But tell me a little bit about how this year's focus on cost and affordability is changing the conversation in Washington and for candidates out on the campaign trail.
Yeah, I think a little bit of historical context might be helpful. So when we ask voters about their most important issue heading into an election, healthcare has rarely been at the top of that list. In fact, it wasn't until 2018 that that was the only time that healthcare has been the top issue for voters. Now we're seeing healthcare rise to the top of that list, but it's around affordability. So it is intrinsically tied to the economy. And economic issues, I think if you talk to anyone in DC or across the country, you are hearing about affordability issues. What we are seeing now is healthcare is the top affordability issue. We asked voters to tell us about the biggest stressors in their households. And we thought with the rising fuel prices this summer that gas prices would be at that top of the list. It's still healthcare. So healthcare costs are weighing really heavily on American families, and it's top of mind for voters right now.
Tell us a little more about the historical context there. So 2018, President Trump also in office.
Yes.
The ACA also top of mind in Washington.
But failed repeal, right? So that is what, it was immediately following the failed repeal of the ACA. And so that was a motivating force for Democrats headed into that midterm election. They were going to preserve their pre-existing condition protections, something that had been dominating the DC news and coming out of the failed repeal. And so what has happened now is not the same thing. There hasn't been a repeal effort of the ACA. Instead, there have been major changes to the Affordable Care Act, including the lapsing of the enhanced premium tax credits. There's been major changes to the funding of Medicaid, but those aren't going into effect quite yet. So they're not hitting American families yet. So there isn't like a healthcare legislation that people are voting on. Instead, healthcare is more of an economic concern rather than its own standalone issue.
That makes a lot of sense. And I think we're already starting to see in polling how voters are more attuned to it as a question of cost in their budgets. There was a recent Axios poll that showed a plurality of respondents, almost 50%, were more likely to support a candidate who wanted to restore those ACA subsidies in particular. How do you see candidates capitalize on this kind of sensitivity to what is otherwise, maybe in previous debates, kind of a wonky math question?
Yeah, so it's about costs. So 2/3 of American voters say health costs are their top worry. 55% say that their health costs now are more expensive than they were a year ago. And 80% are worried about the cost of living. So all of that is a plurality, a majority, and it goes across partisanship. So tying any changes to their health insurance and their health coverage and their health costs to something that Democratic lawmakers can tie to the lapsing of the enhanced premium tax credits. Republican lawmakers can tie to just blaming Obamacare. That's going to be an effective strategy for their bases.
What candidates, and we're still early in the general election cycle, a couple more primaries to go, but what candidates are you seeing taking advantage of these messaging opportunities on both sides? Who's doing this well?
Yeah, it's hard for me to say who's doing it well because my focus is so much on the public. And so the candidates that are mirroring what the public wants to hear, I think are the ones that are going to be really effective. So I live in Maine, which is an interesting place to live right now. And the conversation around healthcare costs in Maine is really complicated because we're seeing some difficulties for rural hospitals. We're seeing the changes to Medicaid that could affect coverage in the state. And having Senator Collins and our Democratic challenger, Graham Plattner, talk about healthcare costs this fall is going to be a really interesting dynamic.
Tell us a little bit more about what you've seen from Graham Plattner's campaign and his focus on Medicare for all. It's been a trend with a couple of candidates in a couple of different primaries already this year, and a few more to come. Michigan comes to mind. But the focus on Medicare for all, particularly as you were describing the demographics of Maine, people going to be affected by these changes. How has that looked from the ground?
It's interesting to see the conversation around single payer come back up. What we know from polling is that single payer, Medicare for all, Medicare buy-in, whatever you want to frame it as, is really popular. But the public don't know a lot about it. They aren't studying healthcare policy like the people in this room and like what we do for a living. And so they don't understand how it could possibly change their health coverage. So they are really susceptible to messaging around single payer and Medicare for all. So yes, it is, Democratic, especially the progressive wing, may be advocating as that a way to deal with rising healthcare costs. But people are going to be really susceptible if they're like, oh, but that may mean that I may not get to see a specialist when I want to, or it's going to drastically change my employer-sponsored coverage. They won't have it anymore. So those changes are going to be really powerful. And we've seen that can sway public opinion 20, 30 percentage points.
Oh, wow. The fear of lack of access is what sways.
Yeah, so you when you're studying this type of issue, you ask do you support or oppose? And then you give them what we expect to be in the narrative around politics and the media around changes to the proposals. And you can see public opinion shift drastically in both in favor and in opposition.
And on Medicare for all, sorry to just stick with this because we're seeing it from so many candidates. I assume it's more popular with Democrats than Republicans, but you mentioned it's broadly popular. How does that split work out?
Yes, so it is much more popular among Democrats. A small minority of Republicans have favorable views of it, but also it's popular among independents. And in a midterm context, independent voters are the key constituents because, as we all know, midterm elections are lower turnout elections. And so what the candidates are really trying to do is mobilize those independent voters in the general election that may be more likely to stay home in a midterm election year.
That makes a lot of sense. And actually, KFF had some recent polling earlier this year that found that broadly, Democrats are more trusted on health care as an issue than Republicans. But independents, the plurality of them, don't trust either party.
No, it's more than half. More than half of independents don't trust the Democratic Party or the Republican Party to lower health care costs or to lower prescription drug costs. And so that shows an opportunity for candidates on either side of the aisle to try to market a message to that core constituent. Are
you finding that to be a kind of a growing trend in the polling? Have independents always had this kind of distrust of both parties? Are you finding that?
Yeah, I do think it is a growing distrust of the parties. Now, leaned independents tend to act like they're lean partisans. So if you are an independent but you lean toward the Democratic Party, you behave largely like a Democratic voter. But I think what is complicated is for a long time, the Republican Party had the independents trust when it came to economic issues, and the Democratic Party had the independents trust when it came to healthcare issues. Well, what happens when those are combined? And so that is a really complicated, when it's the economy, but it's healthcare, which party is going to be most trusted?
And how do you see that impacting this year's midterms, particularly in, the competitive races or in states that have that just higher percentage of the unaffiliated or independent registered voters?
It's all going to be turnout. I mean, midterm elections are a game of turnout. And so it's what the candidates can be doing and catering different messages to different audiences in order to motivate that group to turn out to vote. I mean, that's going to be the big thing. For midterm election voters, they're making two decisions. They're making the decision whether they're going to actually show up to vote and which candidates they're going to vote for. And so the candidates have to convince them of both of those.
Let me pivot a little bit, but still building on this lack of trust from independent voters or persuadable voters here. How does someone like Health and Human Services Secretary Robert F. Kennedy Jr. or another MAHA leader influence this space, do you think? And particularly in the midterms, Secretary Kennedy has been traveling to a lot of competitive districts recently. His MAHA Institute is quite active organizing people. How does he factor into this equation?
It's their first election, really, with MAHA as a voting bloc. So I think we're still trying to wait and see how it's going to play out. MAHA ideals are broadly popular among Republicans. They are also largely MAGA ideals as well. So 85% of MAGA voters also align with the MAHA movement. So there is a large overlap there. They're popular with independent voters and much less so with Democratic voters. There is a small segment of Democratic voters who align with the MAHA movement, but that's mostly around food safety. And so that could be a way to motivate certain Democratic low-inclined voters to show up if they can talk about that. But even among MAHA, it's costs. So when we ask even MAHA voters, we did a big report looking specifically at MAHA voters and asking about what's going to be most important to show up to get you to vote. And we asked about vaccines. We asked about chemicals. We asked about food safety. And healthcare costs largely outweighed any of those priorities. So MAHA will also have to pivot and talk about costs. Now, there is a connection there, but are we seeing them do that yet? I don't know.
That's fascinating. I feel, and please tell me if you've seen this in the numbers, but in 2024, when he was running his campaign and making his endorsement of now President Trump, the focus was so much more on the policy, on particularly vaccine policy. We were still in the shadow of COVID, and now that's pivoting.
Well, I don't know if it's pivoting. For a core group of MAHA voters, they still care about vaccine policy, but they aren't seeing huge development in vaccine policy from the Republican side. And so, they are supportive of his vaccine policies, but they also want to see more on costs. And so I think they're weighing both of those. And I mean, this is a core constituent of the Republican Party. They are largely going to vote Republican. It's whether the MAHA movement could bring in some independents and Democrats to a Republican candidate on those policies. And I'm not sure they can unless they can cater it around costs.
Oh, that's interesting. And in terms of the support that Secretary Kennedy can bring, we know from his own campaign that he polled around 5%-ish, most consistently. Are you still seeing that support and that base from what you'd call maybe the Kennedy MAHA voter versus the MAGA MAHA voter?
Yeah, it's tepid support, right? So when we ask our basic approval question, they're much more likely to be in that somewhat approve rather than strongly approve. So that he still has support. It hasn't switched to the disapprove, right? They're not against Kennedy, but it's much more tepid than the strong support.
Do you take any lessons from some of the losses, I guess, from someone like Senator Bill Cassidy, who was seen as skeptical by the MAHA supporters. Now, I don't think Secretary Kennedy said anything in particular, but MAHA as a base.
I mean, primaries are very different than general elections, right? And so, and then the primaries, it's also a matter of getting people to turn out to vote. And I think Senator Cassidy had a difficult time with turnout of his core constituents, and his challenger was able to turn out more individuals. And so, but now they have to pivot for a general election. Now, Louisiana is a very conservative state, but they have to still motivate those voters to turn out for the general election. Yeah.
That makes a lot of sense. Unfortunately, that's all the time we have for our conversation, but thank you so much, Ashley, for being with us. Really appreciate your time.
Yeah, it was a pleasure. Thank you, guys.
Introducing our View from the Top moderator and Axios Chief Operating Officer, Allison Murphy.
Good morning, everyone, and thank you for joining us here today. And in particular, thank you to our partner, the Planned Parenthood Action Fund. All that we do at Axios, including these fantastic events, wouldn't be possible without such generous partner support. Now, please join me in welcoming to the stage Planned Parenthood Action Fund's President and CEO, Alexis McGill Johnson. Hi, great to have you. Welcome, Alexis, and thank you for joining us.
Thank you for having me. It's good to be sponsoring such a great conversation.
Absolutely, and we have a great conversation lined up here. It's an important day. To start us off, today marks 4 years since the Supreme Court overturned Roe versus Wade in the Dobbs decision, which eliminated federal constitutional rights to abortion that had been in place nearly 50 years. So let's talk about those 4 years. What has actually changed, and what does that mean about where reproductive health care stands in America today?
I mean, you say 4 years, and like I remember exactly where I was, who I was standing next to, whose arms I fell into, like when that Dobbs decision came down, even though we knew it was coming down, which is like still so powerful. What has changed is 20 states now have restrictive bans. 13 of them are criminal, and at the same time, abortion rates have gone up. Right, so their intended effect didn't actually take hold. We have seen restrictions on abortion infrastructure. Right, providers are, no longer deciding to provide in banned states. There has been a significant decline of OBGYNs matching into states with bans because they don't want to be criminalized for providing that care. So you can understand how that impacts, broader health care. And at the same time, we are seeing people mobilized, right, with great energy because, this is the first time a constitutional right has taken away freedoms from Americans, and every single day they are feeling the brunt of what it feels like to, experience more dangerous pregnancies, right? Which was always a challenge, but to actually know the names of people who could have survived but for an abortion ban, I think has made it very real.
Yeah, it's remarkable thinking that 4 years has already gone through, and there's still changes happening. So just last summer, congressional Republicans passed a provision as part of H.R. 1, and in that they effectively defunded Planned Parenthood by blocking patients from using their Medicaid insurance at Planned Parenthood health centers. So a recent report showed just some of those impacts: a 20% drop in birth control visits and sharp declines in STI testing, Pap tests, and breast exams. So we can hear those statistics and they're remarkable, but then what do those mean in real human terms? How should this mean we should be thinking about that change in healthcare access?
Yeah, I mean, so look, the battlefield has moved, right? The intended, the intention of Dobbs was just to eliminate abortion access, right? Or under the opposition's argument, just to return the decision to the states. But we've seen it metastasize to all other, fields, whether they're attacking mifepristone or defunding Planned Parenthood. That has been, the goal, right? To ensure they're not only attacking political opponents, but getting rid of access to healthcare broadly. So they came for abortion rights, but instead they attacked cancer screenings. They attacked STI rates. We've seen a 25% decline in cancer screening. Senator Wyden, who's going to be on next, issued an incredible report with some colleagues that helped really understand the full impact. There are nearly 30 Planned Parenthood health centers that have been closed, largely in rural areas and medically underserved areas, because this was really designed to be a backdoor abortion ban. This was designed to come and attack, the very people that many of these folks say they serve every single day. But, when, it's about sexual and reproductive health care, it's almost like we are not equal.
Yeah. And we were just hearing a bit in the last segment about how Americans are thinking about affordability right now, and how healthcare, and particularly healthcare affordability, are a top topic as we think about the upcoming midterms. These are understandably big voter concerns. When people can't get the care they need, whether due to cost or political interference, there are real consequences. So with the midterms on the horizon, and these being the issues, how are Planned Parenthood advocacy and political organizations translating these real-world impacts on policy and healthcare into affordability for voters?
Yeah, well, I mean, look, defunding healthcare is deeply unpopular, as we know. Defunding Planned Parenthood is also deeply unpopular. And what we have here, like all elections, are about choices, right? The Republicans have made choices to gut Medicaid, to not support subsidies for ACA. We've seen premiums skyrocket, predicting upwards of 100%, right? So now you have Americans also making choices, right? They're choosing between filling their gas tank and filling their prescriptions, getting an IUD or getting their insulin, making a doctor's appointment or, making rent. Like, all of these choices are going to be front and center in the voting booth. Our job at the Action Fund is to help people understand who is responsible for those choices, right? Who created the gap, right? And we can very clearly point to the big, beautiful bill, HR 1 that came in and gutted all of healthcare, right? And they're holding it off strategically until after the midterms. And then also, who's filling the gap, right? When defund went into effect, Planned Parenthood health centers filled a gap of $45 million, being able to see patients every single day because we weren't going to turn them away. So, that's why people trust Planned Parenthood Action Fund as a strong messenger to come in and actually help make meaning of what they are experiencing. And so, I'm confident that in the midterms, the folks that we are talking to are going to truly understand those choices in healthcare.
Absolutely. Now, you've personally been leading Planned Parenthood Action Fund through one of the most difficult and consequential stretches in its history. So what is it that you would most want people who care about healthcare and abortion rights to understand about what's at stake in this moment?
Oh my goodness, yeah. So from COVID to Dobbs to defund, that's my tenure.
It's been a stretch.
Yeah, it's been a stretch. I think elections are always about taking a temperature in movement, right? I think of the work that we do in fighting for reproductive freedom. That's movement work. And, elections, campaigns, we will get the results based on, kind of the work that happens in an election. And what's at stake is obviously, access to health care. It's access to saving lives. And we have to continue to put that front and center. But I think the measure of the movement is really how we fill our ranks, right? And I think over the last, not since before Dobbs, really, since 2016, we have been, filling the ranks of reproductive freedom warriors in ways that I think have been incredibly powerful. And while these have been incredible, we've experienced incredible losses, and it certainly have come at the loss of lives of real people. The real work and what's at stake to build a brighter future is about how we grow more people into the movement. And so, I'm thinking about this election both as, putting a check on tyranny, because that is the immediate thing that we must do, but also to how we grow the ranks to reimagine the future for reproductive freedom and healthcare, because we need to play a long game. The opposition had a long view, and if we are not thinking about that in the same way, then we're missing the mark as a movement.
Yeah, and let's talk about that long view, because of course, especially here in DC with midterms coming, we're so focused on that moment. But as you say, this is a movement. This isn't about a moment in time. How do you think about positioning for those future fights?
Look, everything is, again, how do we get how do we get back into the Constitution? That was the first question that we asked of the day of Dobbs, right? Like, who are we going to be now that we are no longer defending Roe? Right. What is going to be the next iteration of freedom, right? We know Roe was the floor. And so if we have the opportunity to reimagine and redefine who we are going to be in, and use 26 and 28 and 2030 to get there, that's the work that we have to do, right? We need to build a national durable right that no government can take away from us, right? And that means that we have to, that's why the building the ranks is so critically important.
Absolutely. So we have time for about one more question. At Axios, we are known for saying, what's the one big thing? Ooh. And so as we think about today and all that it entails, and I know you've got a full agenda, what is one big thing you want to make sure to share with our audience today and to keep in mind?
Oh my goodness. One big thing is, that there is a plan, right? That we are thinking long-term about the work ahead, that we are working very intentionally state by state to, again, grow the ranks and build the power that we need. And, look, in this election cycle, as we will see, people will continue to show up. They are incredibly upset about all the things that are happening over the last couple of years. And that should be the measure of what we see moving forward.
Yeah, it really comes down to the people in the end.
It does, always.
Thank you so much for such a wonderful conversation this morning. We are just running out of time, so we were spot on with the agenda, and we'll have to end the conversation now. But thank you for joining us. And again, a huge thank you to the Planned Parenthood Action Fund for supporting this morning's event. We still have 2 more great segments following this, so please stick around.
Great, thank you.
Put your hands together for Axios Weekend Editor, Erica Pandey.
Good morning, everyone. It's a beautiful morning in DC. This is actually my first Axios Live event back from maternity leave, so I'm both very happy to be here and very intimately familiar with healthcare affordability. Our next guest is ranking member of the Senate Finance Committee. He's a longtime leader on healthcare policy. Please welcome from the great state of Oregon, Senator Ron Wyden. So I know we've got a lot to talk about. I'll start with my first question for you, which I have down, and then I know you've got something you want to add in. But we've talked a lot on the stage already about how healthcare is going to be a defining issue this midterm cycle. We recently had a poll we released with Axios on Monday. 72% of Americans of both parties are really worried about their insurance costs going up this year. What can Congress deliver the fastest and the most realistically on healthcare affordability now?
Well, clearly we can deal with insurance abuses. These insurance abuses are completely out of hand. That would be one thing. And second, we can reduce red tape and bureaucracy. The Republicans are adding red tape and bureaucracy. In effect, they're using it as a backdoor way to deny care. Let's get rid of the red tape that the Republicans are pouring into health care. That's the way to make care affordable, a little bit more affordable right now.
I know you're passionate about, it's not just affordability, it's also simplicity. I mean, it's very complicated. Even things like finding a doctor, figuring out what's covered, things like this make healthcare not just a money headache, but just a logistical headache for people. Why is simplicity a big part of this conversation?
Because we really don't have what people have in other places like Europe, which is more a one-stop approach in terms of healthcare. We go through layer after layer after layer. We're going to spend trillions of dollars this year on red tape and bureaucracy just trying to get people access.
What are some examples of like specific, pieces of red tape that you just want to take the scissor to right now?
Well, the thing I'd go after right now is what Republicans have done to Medicaid and other health care programs. They're making it harder to get coverage. They don't want to have a debate on denying coverage. They know that's a loser, particularly for older people and others who depend on it for long-term care. So what they do is just pile on more rules and claim, oh, what we're doing is stopping people from cheating. That's baloney. They're denying care, and they're using bureaucratic strategies to do it.
We're about a year out from the One Big Beautiful Bill Act. what changes have you already seen? What have you heard from your constituents on how it's changed their lives?
Well, rural hospital folks feel like they've been hit by a wrecking ball. I have town hall meetings, and all my counties had more than 1,000. And a couple of them have figured out that the Republicans have done something I've never even seen. Their proposals are so bad, they won't even talk about them before the election because they're waiting till after the election to put them in. That's a first.
And what about, I mean, so Democrats have been campaigning on health care, and they are continuing to through the midterms, but we still have President Trump in office. What can Democrats credibly offer to voters right now, and what goals might have to wait until 2028?
Well, we're looking for additional ways to hold down services that are so important. Jeanne Shaheen, for example, has been working on a bill involving insulin costs. That's something that we've done in terms of the first steps, but we could do a lot more, and we're focused on those kinds of things, insurance abuses, reducing the red tape. Those things all add up to affordability now.
Another thing, you know, people have said that they really want lower drug costs. This is something you're also passionate about. They seem to be all kinds of proposals people are in support of. They are, you know, Trump RX is popular in some circles.
Trump RX is baloney. Basically, they keep talking about how it's going to help people so much, and they want us to write it into black letter law. So we said, well, before we write things into black letter law, you have to tell us about the details. They haven't been willing to do that.
What is the smart approach to lowering drug costs?
Expanding negotiations. I mean, when you're talking about millions and millions of seniors, the proposition that you don't use their leverage every single day is absurd. It's contrary to everything we do in markets. And I'm going to be announcing some new choices tomorrow for seniors, and we'll talk about that yet tomorrow.
Well, heard it here first.
Yeah.
I know that long-term care is also something that you're passionate about. That's becoming, I mean, just demographically, America is getting older. A lot of people are thinking about how to care for their parents, how to afford wonderful care for their parents. What is the long-term care picture you're seeing? How do you tackle that issue? How do you think about that?
There is no possible reason to not work for care at home. You know, we can clearly come up with alternatives that are better than some of the institutional care. It's more of what seniors want, and it's less expensive. We're dedicated on the Finance Committee, the Democrats, to finding a home for every older person and every disabled person.
So one thing that does unite Democrats and Republicans when it comes to healthcare issues is pharmacy benefit managers. You know, they're not very popular. President Trump has pushed for new transparency around it. You've worked with Republican colleagues on legislation to tackle this issue. We like to say at Axios, talk to me like I'm a smart friend over, you know, a cup of coffee, but I don't know anything. Why should people care about pharmacy benefit managers?
Because they're middlemen. A big part of that multi-trillion dollars that we're spending on healthcare this year goes to middlemen, and that's what we singled out with PBMs, and that is going to be a big part of our cost containment strategy going into next year. There's so much going to various kinds of people who offer services that really are duplicative of what's in the supply system right now. We can make a lot of savings by going after middlemen. There's bipartisan support, as you said. We got our vote out of the Finance Committee 26-0. You can't get a 26-0 vote in the Senate to order a 7-Up at this point. And that's an indication of how much interest there is in going after middlemen.
And are there any other issues? I mean, there's the Break Up Big Medicine Act, you know, that Senators Warren and Hawley are collaborating on. Are there any? The insurance abuses are just out of hand right now, and they're really beyond the ability for the typical consumer to get access to help. I was director of the Gray Panthers for about 7 years. I still get calls from people who are psychiatrists and people in the healthcare profession saying, help me get a parent through the Medicare headache. So it's the complexity thing you're hearing about.
The complexity of the system, even for people with multiple degrees in our country, are still trying to win their way. We can make it simpler and easier to get access.
So, you know, you've got the perspective from town halls in Oregon, in your district, or I'm sorry, in your state, and also here. What is the one trend in healthcare that Washington is missing right now, that they're just not seeing?
Well, I think Washington has got to pick up on the role of AI in healthcare. There are a lot of people who say to you, well, this might help save my cousin who has such and such disease, but don't there have to be guardrails? And Washington has been slow to pick up the debate on healthcare.
And what do you think of more and more people going to these chat bots to ask their healthcare questions and making them ChatGPT their doctor? Because it's the cheapest way.
I'd be a little careful about all that kind of thing. I think that's the debate about guardrails. People are talking about, innovation and technology. We all want that. We all want cures. We all want basically healthcare is the most important issue, because if you and your loved ones don't have your health, everything else goes by the board. That's what I think we need to focus on. It's the most important reason I'm in public service today.
You've been working on this issue for decades. I want to kind of zoom way out for a second. Say we were sitting here having this conversation in 2046. What would you be the most disappointed that we hadn't fixed in healthcare?
Long-term care. To give you an idea, I was a young member of Congress, had a full head of hair and rugged good looks, and I got put on a task force decades ago to figure out long-term care, and I think we can do it. It's all outlined at wyden.senate.gov and information on the Finance Committee. I want to see us make sure that's what I want to do as a priority for my time in public service, is expand access for seniors, starting with long-term care.
And then, as a follow-up to that, what's the biggest hurdle to expanding long-term care?
Well, the biggest hurdle, of course, is the machinery of finding the key places where you can make a big difference. For example, I think the big challenge is workforce. And there are a lot of people in the country, I think, who would like to be part of offering good care to seniors. We'll have some more to say about it as we work through our task force on the Finance Committee on that.
Senator Wyden, first of all, do you have anything else you want to add? I know you mentioned backstage.
I wanted to say something about Alexis, because we're all talking about Planned Parenthood today. To give you an idea how obsessed Republicans are about denying the rights of health care to women, it's all through the debate about the ACA when we were talking about the tax credit. The one issue that the Republicans brought up every single day was the Hyde Amendment, which basically denies, federal funding, and kept looking for ways to deny care to deny care to women in our country. Jean Shaheen used to tell me that she came back every day and was listening to the Hyde Amendment discussions again and again when we thought we might be talking about tax credits. And I think it's important to reflect on that fact today, because the Republicans, anytime there's a debate about health care, anytime you can set your clock by it, they'll turn it into an anti-abortion discussion.
We've covered tons of heavy topics today. You've said there's a lot on the agenda. We do, though, at Axios like to end on one fun thing. I, like many Americans, I'm a big fan of Pacific Northwest summer. So what is your favorite place in Oregon in the summer?
Cannon Beach, where my wife and I were married.
Beautiful. Thank you so much, Senator Wyden, for joining us.
To be continued. Thanks.
Welcoming back Brittany Gibson.
Hi, everyone. Please welcome our next guest, the Congresswoman representing California's 37th District and a leader on health equity and federal funding priorities in this space. Please welcome Representative Sydney Kamlager-Dove. Hi, Congresswoman.
Hello.
Thanks for being here with us.
Thank you for having me.
So let's jump right in. At the same moment that we are talking about the voter focus on healthcare costs, affordability, and access, we're seeing a wave of candidates running on Senator Bernie Sanders' legislation for Medicare for All. Not all of the candidates are winning, but many of them are, and they're really bringing this issue back to the forefront, this campaign cycle. What lessons are you taking from that?
Well, the lesson is that healthcare remains an incredibly important issue, and it will always be on the ballot, quite frankly. But it's also tethered to affordability, because when folks are thinking about healthcare, they're also saying to themselves, can I afford it? Can I afford to get sick, right? Am I having to make decisions about getting to work, or going to visit my doctor? And how much will it cost? And in California, what we've seen is that healthcare has been on the ballot this past primary. HR 1, the big ugly bill, got passed. We have been very strong about communicating with folks what it will mean to them, to their household, to their pocketbook and their district. And we've seen Republicans sort of try to walk away from H.R. 1. In California, we actually saw a Republican change his party to becoming an independent because he was like, oh, snap, I don't want to be caught holding the bag with this H.R. 1 and its $1.5 trillion in cuts. In my district and in my county, we actually passed a local measure, Measure ER, that would have a half-cent temporary 5-year sales tax to fund public health because we are anticipating the loss of revenue as a result of H.R. 1. So it was on the ballot for sure throughout the state of California.
Wow. Tell me a little bit more about how you make those connections for voters, especially between H.R. 1, the One Big Beautiful Bill, and their pocketbooks, their immediate costs. Like there's a lot of steps of the math equation for voters from here in Washington to the 37th district.
Oh, I don't have to ask them anything. They run up on me at the grocery store and they say, what are you doing? What are you doing to lower the costs? So in California, gas is almost $7 a gallon in my district. And folks are saying, I can't even afford to get to the doctor. On top of the fact that we've had 6 out of 13 LA County clinics close because of loss of revenue. We are hearing from 4 or so hospitals that are possibly considering closure, and that's going to put pressure on the remaining hospitals and emergency rooms. And we're hearing stories of folks who say, well, I can't afford to go to the doctor, so I'm going to hold off on this issue, and then that metastasizes. I also happen to be co-chair of Planned Parenthood Los Angeles, so I see it on that front as well. People are struggling, and they're saying, what are you, Washington, Republicans and Democrats, what are you doing to ensure that I'm going to have health care? 700,000 folks in LA County are going to lose complete health care access because of H.R. 1. They will lose their insurance completely. That's all of the folks in my district. If you look at that number, that's huge.
Who are they blaming? Especially when they come up to you in the grocery store. I bet that's fun. But
Kind of is. They also say thank you. They say thank you for fighting and keeping it real. They're really blaming the system. They're saying, what is this dysfunction? Because I will also tell you that most folks say, I am willing to pay into a system that will guarantee I and my neighbors have access to health care. That's why Measure ER passed. So everyone looks at the community and says, I'm willing to chip in. We say, I'll chip in so that you can call 911 and I can call 911. I'll chip in so that you have access to the fire department and I have access to the fire department. And they also say they'll chip in so that everyone has access to health care, because people do know that if their neighbor is sick, it is somehow going to impact their community. But they want all of us working together, and they cannot understand why Republicans passed a $1.5 trillion cut to all of their health care, and then they see the reflecting pool madness, this arch drama, this fair that's happening out here, this war that we're estimated to be spending $100 billion on to what? I mean, there are just so many questions about how their money is being spent and why they continue to feel like they're being left out.
How does that break through, especially in LA County, across the country? How often do you hear about the reflecting pool? The local news in DC is all over it, but I imagine it's not quite the same in your district. How does that break through?
Well, my district is, I'm not going to say they're hyper-focused on him because everybody is protecting their sanity, but it does come up because there's just so many questions. So why are we not getting our FEMA money? Why are we having to fight to get money to help us prepare for the LA Olympics? Why did we have to fight so hard to get security funds for the World Cup? All of these things are happening in Los Angeles. And then why are you, wasting $100 billion on this war with no accountability? Why are you saying you're going to go into Venezuela and take their oil, and then who's going to get the money? Then all of the other things, the reflecting pool, the Air Force One debacle, I mean, just the UFC fight. So they do ask questions, and then they say,
how can you hold this administration accountable? And then we have to have another conversation about what it means to be in the minority and how we are stretching the tools that we have and working really hard to win in November so that we can change on day one how we manage accountability, transparency, oversight, all of the things.
How does this conversation change? Obviously, your district and California in general is majority Democrats, but when you're hearing from independents or more persuadable voters, how does highlighting these opportunity costs, if you will, how does that conversation change? And in our previous conversation, mentioning the KFF polling, particularly among independents, we know there's a distrust of either party. It's almost a distrust of the system overall, as you were just saying with healthcare too.
So I'll give you an example. I had a listening session in my district not too long ago, and we did it with veterans. And my staff said, try to be nonpartisan, because this is a group that doesn't really want to have you jump down that rabbit hole. And so I did. Now, they were saying that because these veterans were Democrats, Republicans, and independents. And so they didn't want to hear any kind of partisan messaging. They did want to talk about their issues, and their issues were the VA and not having adequate access to health care. Why are they on waiting lists for so long? How come they don't know who their care manager is? You know, how come they don't have any help accessing their benefits? Why are they having to struggle through a very complicated network and web of services when they actually serve this country and feel like there should be more people trying to help them? How come they're having challenges getting their vouchers for housing? Why are they getting kicked off their sort of registration path when they're trying to go back to school? Those are real questions, and you could extrapolate that scenario and put it into any neighborhood or community across this country, and you're going to hear the same sentiments and the same frustrations. And I wasn't saying, well, hey, this is what the R's are doing, this is what the D's are doing. I was saying, like, this is how we need to work together to make government work for you.
It sounds very similar to the conversations we're hearing across the country about voters wanting their representatives to fight for them, to advocate for them. Last fall, when one of the government shutdowns happened, it was really framed, particularly on the Democratic Party side, as a fight to extend the ACA premium tax credits, those subsidies that would lower people's costs. How does that fight look to you now, about half a year later, another government shutdown later? How do you reflect on that?
Government shutdowns are painful because you know that people are working and they're not getting paid, but the bills are still coming, okay? And so it is very hard to explain that. I will also say that when I went home to my district, people said, keep fighting. I understand why you're doing this, because we need health care. I was visiting community clinics, I was going to SNAP offices, I was going to WIC offices, and hearing stories from patients and providers who were saying, I don't understand why you're going to kick new mothers off of this plan so that they cannot access formula. I don't know why you're going to make it harder for us to get reimbursed. I mean, those are seniors were saying, am I going to lose my health care, and what will that mean for me? And when I see a senior, I see my dad, I see my grandmother, and it's painful. So they understood, and they said, keep up the fight. Then we had the second shutdown. People understood it. They said, well, don't give more money to ICE. Don't give more money to Border Patrol. They have enough because of the prior funding, but I don't want my money to go to see people killed in the streets. That's not how I view immigration reform. So people are with you if they know that what you're doing is for them. So I got far more thank yous. And please, federal workers obviously were saying, can you open it up a little sooner? And we were like, yeah, we will. We just don't want $140-something billion going to ICE and CBP with no accountability. And they were like, amen, queen.
That makes a lot of sense. And it's how often do you hear voters connecting their day-to-day, as you were saying, you're visiting clinics, you're thinking about the mothers who will lose access to their to benefits to support them and their children, to the spending on the immigration policy, to the spending, the majority of the One Big Beautiful Bill going to DHS programs, not things that are immediately impacting their pocketbook. How often do you hear that?
I think people are far more engaged now because they have access to the news 24/7, and you're in these kind of doom loops, with the scrolling. So they're connecting all of the dots. And they're also saying, why are we spending so much time talking about this guy who is indeed a menace to the economy and our healthcare, and instead of working on solutions? And so what I do when I go home is I sort of talk about what we're trying to build for. I do this, I send an email out to my supporters and constituents. I haven't done it in a while, but the last one I sent out was rather long, and I told them why I hadn't been writing in a while, and I talked a lot about healthcare. I went to a birthday party for a friend who was 95 years old, struggling with cancer. I have a very good friend who had vertigo and shingles and cancer all at once and was trying to navigate the healthcare system, and my own father. And believe it or not, I got emails from folks who said, thank you for sharing that story. This is my story. I too was going through so much, and I am so glad that you're focusing on this while you're also fighting against all of this madness. So I do think folks are able to synthesize and connect the dots, and ultimately people always bring it back to the most important person in their life, themselves.
That's fair. And when it comes to where the government's attention and definitely the spending has gone under the Trump administration and the Republican Congress, you are on one of the committees with oversight over DHS, and have been highlighting that spending, highlighting what this administration is doing. Talk a little bit about how that factors in, in these conversations and your ability to, even from the minority, be a watchdog on that agency.
Well, as you know, Kristi Noem came into our committee and she got it handed to her. There were a lot of questions about how she was managing that agency, these no bid contracts that were coming in, who was responsible for approving them without any clearance, and also FEMA, because they're over FEMA. In Los Angeles, we are still recovering from the urban fires that impacted the Palisades and Woolsey in the Antelope Valley and also in Altadena. And we have not gotten our FEMA money because Donald Trump doesn't like Democrats, or maybe doesn't like the mayor, whatever. But I was not the only one thinking about FEMA. There were Republicans that also were asking her questions, and they were asking about their money. The same thing happened in the Senate. So that's how you hold someone accountable, because the person who lost their home, the person who lost all of their pets, and I know those people, I have talked to those people, they do not care about anything that Kristi Noem was doing other than if she was approving disaster relief for FEMA so that they can have help rebuilding their home. And the fact that that has not happened over a year later is highly problematic, to say the least. And that's what she got called on the carpet for.
No, that's absolutely true. It was an interesting set of bipartisan questions. You were quite late in the order of questionings in that Judiciary Committee hearing. There's not much that can get you to perk your ears up after 6 hours in a windowless room on Capitol Hill, but you did perk my ears up. You asked Secretary Noem about her personal relationship with then Special Government employee Corey Lewandowski. Why did you feel it was important to ask her that on the record, take that opportunity in that committee room?
I was also asking her about her judgment, and I needed a little clarity on who was making decisions. DHS is one of the largest and I think most important agencies, in the government, and lingering questions about is she the one making these decisions or not? Because I don't know about you, but if I'm in a relationship with someone, I am listening to, I listen to my husband. We're talking all the time at night. Now, but my voters did not vote for my husband. So they want to know, am I making my decisions? Do I have clarity? That was what that was about. And there's been too many articles, which I also entered into the record, about her and this guy who had unfettered access, who was actually signing contracts, whose signatory was in the ledger, who was meeting in her office, who was traveling with her, who was actually, we were being told that if you wanted to get your FEMA money, you had to call him and make a deal with him. So my question was, lady person, who is running DHS? Is it you or not? And she could not answer the question. She had some long answer with all the words, and no word said no.
Is that something you think will come up again if Democrats win the majority?
About her?
About her and who is making decisions and ideas?
It's all going to come up. I mean, when we win the majority, we're going to be investigating everything because, you know, this is a referendum on the corruption that we see happening, the collusion that we see happening, the high cost of living that we see happening. Why is gas, you know, $4, $6, $8? Why is it that we're spending money on this UFC South Lawn fight and you're cutting my health care for my grandmother? You know, why is it that I'm calling and having to fight to get my benefits from the federal government? Why is it that you're saying you're going to shut down portions of Social Security or Social Security offices that are in high rent neighborhoods because you're trying to cut down on costs? You know, why is it that you're changing how I'm able to receive and send off my mail? That is not how a functioning government should work. Why is it that you came in here with this Doge platform and then somehow are trying to gain access to all of my Social Security and personal data information? Like, why is it that you're holding hostage FISA and due process for American citizens because you're trying to get some dude that's like your homie into a cabinet position to do God knows what? Like, why is it that you are threatening the head of the Federal Reserve because he's not doing what you say you want done? So like, those are like real questions, all in the sea. Like, it's costing us more to live and we're getting less protections. You're all about the corruption and the collusion, but then you're distracting because you don't want people to know. Like, that's too much. So when we win, and I'm going to knock on some wood that we will, I think one of our roles is to continue to expose the hypocrisy that's going on, but call these folks back and have them explain. You know, like, and my thing is this: if you care so much about HR 1 and you think it was so great, then you should be on the trails talking day and night about the bill. But why are you running from it?
Well, I'm sure this audience in particular will be interested to see you and your colleagues keep asking those questions and maybe getting some answers. But unfortunately, that's all the time we have for today. Thank you so much for being here with us, Congresswoman. And a special thank you to our sponsor, Planned Parenthood Action Fund, for making this event today possible. Thank you all for being here with us.